Gabby Baker has a lot to be excited about. She just graduated from high school. While many of her friends are saving money to pay for college, she has one worry off of her mind.
They're more worried about college, and I already have a full-time job set up.
For 2 years, she took classes at Massanutten Technical Center to learn how to become a dental assistant, following her dream of working in a dental office like her aunt.
I have a lot of people ask if it's worth it or if they should take interest in it, and I've always definitely told them yes, because it's helped me with more skills than just in a dental office.
It was a similar path Jay Davis at Mountain View Dental took before getting hired full-time.
I worked here in the afternoons, and then as summers came, I started working, during the day, shadowing on the side.
To be a dental assistant, you will need to go to a technical school, such as Massanutten Technical Center, or get a certification. And you may also need an apprenticeship.
We get a lot of shadows that come from MTC. They kind of come, watch everything, learn as much as they can, and then we actually end up hiring a good bit of them.
Economic statistics gathered by the Shenandoah Valley Partnership reflect the average wage in our region for this job is $35,000 a year, and there will be a need for more than 180 dental assistants over the next decade, a perk of this job for Baker.
I never wanted to go too far away. I'm not into going away for college, moving away. I always need my family close by.
Baker says she has a lot to smile about, but says it's the smiles she'll be working on in the Valley that matter the most.
Courtney Fallon is in her second year of training at Massanutten Technical Center to become a licensed practical nurse, or LPN. It's a career that works for a people person.
We get to meet a lot of new people, and I think that is the most interesting thing ever, because if I wasn't in this field, I don't think I would get to meet the people that I have met so far.
LPNs typically work in places like retirement communities, doctors' offices, clinics, and outpatient centers. Fallon feels it's a career with endless possibilities.
I think it will just keep on expanding. There's so many fields you can go into. I mean, you could go to be a mental health nurse, a pediatric nurse, really anything.
Francesca Troutman is on the job at an LPN at the Sunnyside Retirement Community in Rockingham County. It's a group of patients that she enjoys helping stay healthy.
I really enjoy geriatrics and just helping with the elderly. So I went to nursing school. I went to Page County Technical Center, and I actually did my first year of the LPN program with my senior year of high school, and then completed the program the next year.
She helps the people who live at Sunnyside with their appointments, checking their vital signs, and also helps deal with any emergencies. It's that interaction with people that also draws her to the field.
Definitely the relationships I get with the residents, and just getting to spend time with them, getting to know them, and just getting to enjoy working here at Sunnyside.
According to economic statistics gathered by the Shenandoah Valley Partnership, there are nearly 1,000 LPNs in our area. Over the next decade, the Valley is projected to need an additional 474 LPNs. The average annual salary for the region is $38,700. Training is usually in a technical school or a private training school. LPNs also need to be licensed by the state in which they work.
I just find it to be a very rewarding career. I have been very blessed with the different opportunities and experiences I've had as an LPN, and I would recommend it to anyone.
In the healthcare system, we see doctors and nurses on the front lines.
You don't ever see the end user of where that chart goes to, who maintains that chart.
There are several people like Luke Vicario working behind the scenes to keep the information about your health organized and easily accessible.
As lead specialist, I maintain the electronic medical record. So everything from the form IDs that the scan stuff goes into to the electronic stuff. And it kind of all incorporates into our legal medical record.
Medical records are no longer just row after row of paper files. Vicario manages these records electronically.
I started out in high school as a youth mentor through the high school I went to, and they saved part of our paychecks for college fund, and where the hospital matched it and they doubled it, and I got put into medical records. And I did that for 2 years in high school.
He started at Augusta Health 8 years ago. Vicario's journey began in Oregon when he was in high school.
Because I had 2 years of scanning experience, and I already knew the terminology. I took medical terminology in high school, so that was a huge help and help getting the foot in the door and stuff. And then as positions just came open, just moved stuff up over the course of a couple of years.
According to economic statistics gathered by the Shenandoah Valley Partnership, the average salary for this position is more than $37,000. There will be a need for 114 additional positions in our area over the next decade. Training is typically vocational school study, on-the-job training, or an associate degree.
Because you continue to grow. You have a lot of growth. Like I started 8 years ago, and I don't even remotely do the same thing. And it's a good advancement. It's a good place to get in the door, but there's a lot of growth and advancement too within this department, also with elsewhere at the hospital.
Ron Copel says his job is the best kept secret in healthcare.
This field has been around for 40 or more years, and I'm just surprised at how few people, coming out of high school haven't been counseled that this is out there.
Copel found out about respiratory therapy because his mother worked at a hospital as a nurse.
I was a floundering senior in high school with not any real direction, but I was always interested in science. I liked medicine, but was not willing to go down the path of, being a doctor. I spent one afternoon there and I was hooked.
Respiratory therapists make sure your lungs work properly. They work with newborns all the way up to grandma and grandpa and can work in any part of the hospital. Kara Baker, who works at Augusta Health, says it's a rewarding job, hearing people talk after not being able to for days.
I had one patient one time, I extubated him and then I heard him on the phone, real raspy to talk, and he called, I assume his wife, and said, "They just took the tube out, just want to let you know I love you."
To be a respiratory therapist, you will need training at a vocational school, related on-the-job experience, or an associate's degree. The average wage in the Valley for this position is $59,000 a year, with a demand over the next 10 years of 55 positions in the Valley.
I've only worked here for 7 years, but just in the time I've been here, the hospital's grown and grown and grown.
A job allowing you to work and serve your community and help make people breathe a little easier.